Well, COVID-19 is heavily impacting communities of color right here in our valley. Nurses from those communities are worried about their own health, and they're asking for more equipment to keep them safe. Here's 13 Action News reporter Astrid Mendez.
Nurses have been on the front lines fighting against COVID-19. As they watch their colleagues and patients keep fighting against this virus, they're also struggling to do their jobs with not enough protection. Nurses from different hospitals and associations share their COVID-19 experiences in a Facebook Live hosted by Representative Susie Lee. While they may be from different ethnic backgrounds, they share similar concerns.
PPE remains a huge issue. You can't even find, it's very difficult to even find qualified, and I'm going to talk about the N95s.
We have to make sure that the testing sites, that the care that we're providing that's available is available to everybody.
Also, they've seen firsthand how the virus has spread fear in minority communities.
A lot of the Asian community was afraid of wearing masks because they didn't want to be targeted. And, I think that was a real fear. I had a lot of friends tell me that they, did not feel comfortable, even going to the grocery store. This is just kind of the byproduct of racism and COVID-19 kind of coming together.
We're not getting out into the communities that need it. We're talking about 89101 and 89030, the zip codes that are the highest impact with COVID. And where are we testing? What are we doing? Where's the big major testing in those zip codes? We don't have it. That's impacting our at-risk community. It impacts the Hispanic community tremendously. There's fear of going out and getting tested and having an immigration issue, especially with this administration.
Representative Susie Lee says she's aware of the impact of COVID-19 on communities of color.
Our AAPI community makes up just 7.9% of our population, but accounts for almost 16% of the deaths. Our Latino community makes up 29.2% of our Nevada population and currently makes up 36% of Nevada's confirmed cases. And our Black community makes up approximately 10.3% of our population and accounted for 9.6% of known cases, but 13.3% of deaths.
She promised to keep fighting for their needs, especially better protective equipment for nurses. These nurses also worry that more people will keep dying in our community because of COVID-19, and they ask everybody to keep following social guidelines and to wear a mask in public. Astrid Mendez, 13 Action News.
And a concerning new milestone in the Silver State. Coronavirus deaths have now passed 1,000, and we now have more than 58,000 cases. However, the growth rate continues on a downward trend. Now, Governor Steve Sisolak issuing a statement in light of the new numbers saying, quote, "At this time, I implore all Nevadans to do your part to help slow the spread of this virus to protect those around us."